Welcome to the Gabby Williams Alzheimer's Disease Foundation lecture on dementia and brain health. My name is Dr. Olajide Williams, trustee of the Gabby Williams Alzheimer's Foundation. It is important for us to understand the difference between dementia and normal aging. If you look at the photograph of the brain specimen that's shown in this slide, you can see that the normal brain is a fuller brain, and the AD, which stands for Alzheimer's disease brain, is a more shriveled brain. We call this shriveling of the brain atrophy of the brain, as opposed to the fullness of the brain that you see in the normal brain. My next slide will talk about some of the symptoms of Alzheimer's disease or the symptoms of dementia. But in general, people tend to underreport these symptoms. Sometimes it's because they confuse these symptoms with signs of normal aging. Sometimes the symptoms emerge so gradually that the person affected doesn't recognize them. The symptoms of dementia, or which are also the symptoms of Alzheimer's disease, are many. For dementia, we like to promote the use of a mnemonic by the name of FLOW, F-L-O-W. This mnemonic can help you recognize Alzheimer's disease if it is occurring in a loved one. And it can also help you distinguish these symptoms from normal aging. In the word flow, F stands for forgetting easy words and forgetting conversations, forgetting familiar faces and familiar places, forgetting that they just said something or asked for something, and this leads them to repeat themselves, repeat the question, or repeat themselves over and over again because they forgot that they had just said that thing or they had just asked for that thing. Often repeating oneself might be a sign of Alzheimer's disease. L stands for lose. So these individuals lose important things all the time. We all lose important things once in a while. I, for example, might lose my glasses. I might forget where I put my cell phone, forget where I put my glasses. But when you're losing things all the time, one needs to be concerned that the individual might be suffering from Alzheimer's disease. An Alzheimer's disease patient won't forget his glasses today and remember his glasses tomorrow, and forget the next day and then remember the next day. Typically, the Alzheimer's patients will forget these things all the time. Lose also stands for losing their way, getting to familiar places, or losing interest. O stands for overlook, overlooking regular chores like cleaning up or even paying the bills or even grooming oneself, overlooking safety issues like forgetting the pot on the stove, not dressing properly, safely for harsh weather, overlooking taking your medication so the individual forgets to take their medications. W stands for right. So, or W can also stand for wonder. Sometimes patients with Alzheimer's disease have to write things down, write down lists, write things down, and use these reminder notes because of fear of forgetting them. Sometimes individuals with Alzheimer's disease can wander off with no particular place to go, and then they will get lost, put themselves in danger, which is not an uncommon sign of Alzheimer's disease, wandering off and getting lost. Why does diagnosing dementia matter? I should just say that dementia is an umbrella term for cognitive dysfunction, and Alzheimer's disease is one of the most common causes of dementia that there is. However, there are reversible causes of dementia. When an individual has a cognitive decline, cognitive dysfunction, but the cause is reversible, it can be completely cured. Some patients might have a vitamin deficiency like B12. Some patients might have a thyroid deficiency that's causing this dementia-like picture. And there are other causes of dementia that are not caused by Alzheimer's disease or irreversible processes. There are several reversible causes of someone who is suffering from memory loss, which is very important to diagnose the condition so that you don't miss one of the treatable causes of dementia. So when you see anybody with those flow symptoms that I've just described, it's important to get them to a doctor so that they can be diagnosed appropriately. And if the reversible cause is found, it can be quickly treated. If it's Alzheimer's disease, there are also things that one can do. Some of the things that one could do for Alzheimer's patients include some of the approved medications that we use to treat the symptoms of Alzheimer's disease, and the newer, what we call disease-modifying treatments that can slow down the rate of decline, the rate of cognitive decline in Alzheimer's disease. But these treatments are most effective when started very early on in the disease, which is another reason why it's very important for us to make the diagnosis. If you recognize any of those flow symptoms in your loved one, it's important to take them to the doctor so that a diagnosis can be made, because these treatments that are available, none of them are curative, but some of them can certainly improve the quality of life and slow down the progress of the disease. Early diagnosis also helps with proper planning, having a living will, planning your estate for when you're no longer here, while you're still cognitively competent, and which can help the family prepare for major changes that will come when you are no longer here. Who is at risk of developing Alzheimer's disease? Alzheimer's disease is the disease of older people, typically beginning after age 65. Women are slightly at higher risk than men. There are some conditions that significantly increase your risk for Alzheimer's disease. Those include diabetes, stroke, smoking cigarettes, high blood pressure, and obesity. All of these are risk factors for Alzheimer's disease. Low education, traumatic brain injury are also risk factors for Alzheimer's disease. And in a very tiny percentage, about 2% of all Alzheimer's disease cases, it is a genetic contribution. We're also exploring the relationship between diet and developing Alzheimer's disease, especially since we know that certain diets can help reduce your risk of Alzheimer's disease. So how can we reduce your risk of dementia, and how can we optimize our brain health? The first thing we can do is to maintain a healthy diet. That means eating a variety of fruits, eating more vegetables like bitter leaf soup, okra, efo, edikang ikong, eating whole grains like brown rice or fada rice, semolina, eating more fish, especially fish. Poultry is also a good option, and red meat should be significantly minimized. Limiting sweets and sugar-sweetened beverages, eating more nuts and legumes such as beans or even moi moi, using olive oil and other similar monosaturated fat sources like canola oil or sunflower oil. And it's important to avoid or limit palm oil consumption, palm kernel oil, and coconut oil, which are very high in saturated fat. And then it's important to limit salt consumption. High salt consumption can not only increase your risk of high blood pressure, but it also can decrease the effectiveness of blood pressure medications treatment that you're being treated with. 2 is to participate in daily physical activity. This could include just walking briskly, cleaning the house, playing sports, It's important to shoot for at least 30 minutes a day of physical activity. You can also break this into smaller chunks. For example, you can do 10 minutes in the morning, 10 minutes in the evening, and 10 minutes in the afternoon. But it's very important as you engage in these activities, you engage until you break into a light sweat. That is when the physical activity benefits are optimized. When you walk briskly until you break into a light sweat, you're cleaning the house to the extent that you break into a sweat, or you're playing sports to the extent that you break into a sweat. And try to shoot for 30 minutes every day of such physical activity. Number three is to engage in social activity. We know that individuals of faith who regularly attend service live 4 to 14 years longer than those who do not. Try to volunteer as much as possible in your community. Um, we know that people who with consistently high levels of social engagement have a lower risk of dementia than those who have low levels of social engagement. Social isolation is a risk factor for many, many conditions. And social engagement, increasing social activity in a healthy way, has been shown to promote longevity. The third one is to monitor and control cardiovascular risk factors, things like high blood pressure, diabetes, and obesity. We know that high blood pressure can increase your risk of stroke and heart disease, but it can also increase your risk for cognitive decline, for dementia, especially when you have high blood pressure in your midlife. High blood sugar can also not only high blood sugar not only increases your risk of diabetes, which in turn can lead to stroke and heart disease, but it is also associated with cognitive decline. Being overweight or obese increases your risk of a variety of disorders that are associated with cognitive decline. And making sure you don't smoke, or if you are smoking, to stop smoking, can also help prevent cognitive decline. Challenge your mind is the fourth one. Challenge your mind with interactive games, puzzles, memory games, word games, chess, perhaps even learning a new language or a new skill. All these brain stimulating, mind challenging activities can reduce your risk of developing dementia and increase your brain health. Sleeping well is important. Now in this age of cell phone screens and iPads that we often use, our recommendation is to stay off these screens before bedtime. We also recommend you avoid eating sweets and sugar at night because that can reduce your quality of sleep. Snoring could be a sign of a sleep disorder, most commonly sleep apnea, which we know increases your risk of stroke. But sleep apnea can be treated when diagnosed. It's important to consult your doctor for excessive snoring at night. And if your partner witnesses this, in addition to pauses in the middle of these snoring episodes, it's important to seek a diagnosis for potential sleep apnea. And it's also important to target at least 8 hours of sleep every day. Thank you for your attention. I hope that you have learned something more and helpful for your brain health on behalf of the Gabby Williams Alzheimer's Foundation.